Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hi everyone, today we're going to talk about pantoprazole. This medicine belongs to the group of proton pump inhibitors, which are used to reduce the production of acid in the stomach and intestines. Pantoprazole is often prescribed to treat conditions such as gastroesophageal reflux disease, gastric ulcers, and esophagitis. It can also be helpful in cases of Zollinger-Ellison syndrome, a rare condition that causes excessive acid production in the stomach. And how does pantoprazole work? Simply put, this medicine blocks the enzyme in the stomach wall that is responsible for producing acid. By reducing the amount of acid, pantoprazole helps relieve symptoms and heal the lining of the stomach and esophagus. Regarding the dosage, it is essential to follow your doctor's instructions. Typically, the starting dose is 40 milligrams daily, taken before a meal. For maintenance, the dose can be reduced to 20 milligrams per day. It is important to take the medicine at the same time every day and not to break or chew the pills. Like any medication, pantoprazole can have side effects. The most common include headache, diarrhea, and nausea. If you experience serious symptoms such as allergic reactions or severe abdominal pain, you should contact your doctor immediately. In short, pantoprazole is an effective tool for controlling stomach acid-related conditions. Remember to always follow your doctor's instructions and do not hesitate to consult him if you have any questions. Thank you for watching this video. Take care and see you next time.
If you've made it this far, let us know in the comments why you're using this medicine.